Well, welcome everyone, and thank you for joining us as we begin our webinar series to address critical issues, challenges, and solutions to ensuring equity is integrated into institutional decision-making in response specifically to the COVID-19 pandemic. I'm Dr. Crystal Bedley, the project director for the ARC Network, and I want to thank all of you who registered for this ARC Network webinar. Before we begin, I want to take care of a few housekeeping items. First, I wanted to let you know that the webinar is being recorded, and as I answered briefly, will be made available to everyone who registered. We'll also be uploading this recording to the ARC Network online community platform, and so it'll be accessible through our website, equityandstem.org. As the pandemic has made us all probably much more familiar with online platforms, and many of us are already probably familiar with Zoom, I do want to take a moment just to make sure we're all on the same page with the options that exist. First, if you hover your mouse over the bottom of the Zoom window, you'll see a number of different menu options. In the center is the option for Q&A and chat. Towards the end of today's webinar, we'll be sharing links to our feedback survey and resources related to today's conversation. If you have questions those will be available in the chat. If you have questions for the speakers, please add them to the Q&A. This will also give you an opportunity to upvote questions that you also are interested in that someone else has already posed. And then we'll have the last 5 to 10 minutes of today's webinar to allow you all to have your questions answered by our wonderful guests. We did run into some challenges with the closed captioning. So for folks for which that would be helpful, wanted to let you know that when we upload the recording, captioning will be available at that point. And my apologies for the tech issue that's preventing us from sharing that with you this afternoon. Before getting into the specifics of the purpose of today's webinar, I just wanted to give you a little bit more background on the ARC Network. The goal of the ARC Network is to create and cultivate a broad community that bridges the gap between researchers and practitioners. As a STEM Equity Brain Trust, the ARC Network works to promote systemic change, and the way we do that is by collecting previous work, as well as producing new perspectives, methods, and interventions through a range of activities that include convenings, our curated online resource library, emerging research workshops, our virtual visiting scholars program, and online events like the one we are all in today. The ARC Network is funded by the National Science Foundation's Advanced Program, and the Association for Women in Science serves as the backbone organization. To learn more about the ARC Network, we encourage you to visit equityandstem.org, where you can join the community if you haven't done so already. I also wanted to point out that the ARC Network is built on and works through a framework integrating what we call the 3 I's, which stand for inclusion, intersectionality, and intentionality. We strive to ensure that our work accounts for various social stratifications and our locations within those, and that are intertwined, and to determine the unique inequities that folks experience. And today we hope to provide an example of that work. With that, I'm going to turn the floor over to my colleague, Dr. Page.
Good afternoon, everyone. I am Dr. Stephanie Page, the Community Engagement Manager for ARC Network, and I'll be introducing our panelists and moderating this session today. First, though, I want to give you a little bit of background on the webinar series itself. Back in June 4th of this year, we convened a town hall to recognize the force of inequity and the disproportionate negative effects that are novel to and or exacerbated by the current pandemic. Relatively early on, racial, ethnic, and gender disparities were clearly identified within and out of academia. So we sought to convene stakeholders in the drive for STEM equity in the academy in order to better understand the issues and challenges for equity among faculty, to shape the development of the webinar series, to identify exemplary practices, tools, policy approaches, and general advice that has been emerging in response to COVID-19 in order to support women in STEM and equity work in higher education. And we also wanted to provide ARC Network resources that are focused on STEM equity. The purpose of today's webinar will be to focus on multiple dimensions of integrating equity as institutional decision makers and other impactors of academia respond to the call of continuing higher education, research, and development in the face of an ongoing pandemic. That is why we are so excited to welcome Dr. Gonzalez and Dr. Griffin to lay the framework for our webinar series moving forward. So just to very briefly introduce our amazing guests, Dr. Leslie Gonzalez is an associate professor in the higher adult and lifelong learning unit at Michigan State University in the College of Education and an affiliate faculty member in the Center for Gender in a Global Context in Chicano Latinx Studies. Her research addresses the evaluation of scholars and their scholarship with a special interest in understanding how evaluation of scholars and their scholarship practices shape opportunities for historically underrepresented individuals, especially women of color. She serves as the Faculty Excellence Advocate in the College of Education, where she applies her research expertise to policy and practice. Gonzalez is a co-PI on Aspire, a multi-million-dollar project sponsored by the National Science Foundation, and she is also an associate editor at the Review of Higher Education. Dr. Kimberly Griffin is a professor in the Higher Education, Student Affairs, and International Education Policy program at the University of Maryland. She's also the Associate Dean for Graduate Studies and Faculty Affairs in the College of Education. Her scholarship focuses on diversity within the Black community, mentoring and professional development, and equity and inclusion in graduate and faculty communities. She currently serves as editor for the Journal of Diversity in Higher Education, and she is also a co-PI on Aspire, again, a National Science Foundation funded project that seeks to create more inclusive institutional policies, cultures, and practices for faculty and students from underrepresented groups. Thank you so much for joining us today.
We're so excited to be with you today. Thanks so much for the invitation.
Absolutely. Thanks for having us, Dr. Page.
So I'm going to jump right into a profoundly impactful report that was authored by the both of you. Just to kind of give you a glimpse, we have been doing just a lot of research to just kind of determine the reach of this report. And there are so many institutions that actually have this seated on their website as or within their available resources for their communities. Like, that is just how impactful this report is. What were your main motivations for coalescing this resource?
Shall I go, Dr. Griffin, or do you want to go first?
I think you should start. Your idea, so I think you should start.
Okay, so as you noted, Dr. Page, Dr. Griffin, Kim, and I, we've been working together on Aspire for a while now, which is our grant-funded project. When COVID hit, it was understandable that universities and colleges were sort of shuffling in so many different ways, getting students home, asking folks to transition online for teaching, and there was lots of problem solving that was going on. But it became immediately apparent to Kim and I through our conversations that if we didn't attend to some of the really evident gender and racialized inequities that we were already seeing, that we know have existed forever in the academy, that COVID-19 could really sort of force or compel a real setback. And so we started talking about what we were seeing on social media, in our Twitter feeds, what we were experiencing as women of color who are also, scholars, partners, parents, et cetera, et cetera. And we started to think about what could we do in terms of providing some short-term and even long-term thinking and strategizing for leaders. And Kim, I'll go ahead and let you build on that.
Sure. No, in our work together on Aspire, we're thinking about how we increase the recruitment and the retention of individuals from underrepresented backgrounds, specifically in science, but I think the way that Leslie and I approach our work, we think just generally about how do we recruit and retain and really cultivate a more diverse professoriate. And that this was such a critical moment that, in the midst of saying like, oh, no, we're focusing on the pandemic, it's like, well, the pandemic is exacerbating so many of the problems that we've researched and lived and understood, and that if we try to decouple those things from each other, we're going to end up continuing to exacerbate these problems. I think in the midst of being scholars and understanding these issues in, an academic and a research space, we understood them in a personal space, but in new professional spaces, as we were writing this document, Leslie and I both were considering and taking on administrative roles. So it was very much a shift, reflected a shift in our own personal thinking from, okay, we can study a problem, we can understand a problem inside and out, but one of the things that we often hear from folks who are actually working on the ground and trying to set policy is like, okay, great, I'm so glad you understand the problem. What am I supposed to do to address it? And how can I make it better? And understanding that that's a hard thing. So how can we use some of our best thinking, some of the tools and ideas that we were using in Aspire, just some things that we would want as, again, women of color, academics who are navigating this too, how could we make that into policy, and how could we write that up in a way that was accessible and could be used quickly?
That's pretty amazing to be so comprehensive, and particularly when, as we're considering where we are now, beginning a new academic year, essentially, there's a lot that's at play where, administrators, decision makers are having to kind of allow the start of the new academic year get going and then respond to new problems that are arising or problems that they didn't think would be so big of a problem. So our next question is really thinking about the lens of administrators. And it's interesting that you were in this transitional phase as you were writing the report. What are the kinds of questions that administrators should be asking themselves as they consider, the weight of the decisions they have to make? I'm sure this is just beyond, any level of expectation that anyone could have. But how do you pose questions to yourself that allow you or support integrating equity in your decision making?
I'll get us started, and Kim and I can team tag on this for sure. So I think it's important to first just sort of set the grounding from which we started. When we started this work, we said, okay, we want to approach with a very unapologetic commitment to equity and helping institutional decision makers, administrators, no matter where they sit, approach with equity. And what that means is letting go of more comfortable notions around equality or fairness and really forcing oneself to think about what does it mean to foster conditions, policy, practice, et cetera, to ensure that we retain and maintain any grounds that we've kept when it comes to, for us, we've been mostly focused around gender and racial diversity. And so what that means in terms of question asking, I'll go ahead and get us just started with this set of questions, is starting with the data. And we have like a set of questions that we really encourage administrators to start with. And our thinking is very much informed by some of the work that comes out of Estela Ben-Simmons and Alicia Dowd's work out of USC and the Center for Urban Education and Equity. These questions are, what data do we have? How can we understand the problems and the disparities through this data? Do we have gender data? Do we have racialized data? And if we don't have that data, how do we get it? Mm-hmm. That often means that, institutions do not always necessarily look at the intersections of gender and race. We were really concerned about how COVID was going to have impacts on women, folks of color in general, but we were thinking a lot about women of color who are located in the most vulnerable of ranks within the academy. early in their tenure track often, or often in non-tenure track positions. So what is the data that we have? And if we don't have the data we need, then how do we get it? Sometimes that means scrambling. Sometimes that means that you're dealing with very small ends, but we believe that it is worth it in terms of interrogating policies and practices in this context. I don't know, Kim, if you want to build on that, I'll pass the baton.
No. I think that that's really, really powerful. Both the notion that, our institutional researchers often have access to so much data that we don't leverage, but also really thinking about, do I need to draw together a focus group so I really understand what is happening from day to day and what folks really need, and allow them to share that information in a way that they aren't fearful of retribution or anything like that, but that they really can inform what next steps an institution should be taking. It's really difficult to come up with a solution to a problem when you don't understand the problem and how individuals experience that problem. I think consistent with that, it's really important to ask questions about how you're setting up support and support systems. And I think, really thinking beyond just like, okay, well, we're going to ask people to be more mindful and more thoughtful, that you're really going to have to create policy. There are going to have to be systems in place. And as we create those systems, do they recognize, do they see, do they center the most vulnerable and the most marginalized? I think of the example with universal design in teaching, that when you center the most marginalized, when you center those that might have learning challenges or different levels of limitation to their physical abilities, your class is often better and more inclusive of everybody. So how do we do the same thing when we're thinking about policy and trying to offer support and resources to individuals? How do we ensure, one of the things that Leslie and I really struggled with in writing, or not struggled, but wanted to be mindful of, was that, we think about and we write about tenure track faculty and full-time faculty in one way, but is policy missing folks who are part-time, folks who are clinical faculty, folks who aren't thinking about tenure and promotion, but are still experiencing some really significant challenges? How do we really wrap systems around everybody to make sure that they're getting the support and the resources that they need? Leslie, do you want to pick up on another set of questions?
Yeah, absolutely. So as Kim and I were thinking through this for today, we came up with some questions around data. We came up with some questions around policy and support systems that Kim just covered. And then we came up with a really specific set of questions around evaluation. And Kim already started to allude to these. These are the questions that have been the stickiest and that I think that campuses are really grappling with the most. Because the question is, what constitutes productivity in this context? And what does it take for us to sort of recalibrate and also view that recalibration as valuable as to what it means to be productive? In a lot of my work, I often talk about what does it mean to do worthy work. And so that really requires that faculty across all disciplines have an appetite to sort of reimagine what it means to evaluate someone and to award tenure for a portfolio that might look very different. So I've been talking to faculty in my role as faculty excellence advocate, and I've spoken to many faculty, particularly women, particularly with smaller children at home, who have been very honest and said, I haven't been able to write since March. There are going to be downstream effects for that that are not that woman's fault, right? It is not that faculty person's fault. It is the context that we're living in. And so we encourage administrators, leaders to think about, what does productivity need to look like in this context? How can we, in our evaluative practices, invite scholars to talk about that context, to talk about how they have innovated, coped with COVID-19. Maybe they've done something really interesting around teaching. Well, how do we celebrate, recognize, and validate that in our evaluative practices? So that's another set of questions that we touched on that we wanted to share with folks today. And let's see. Kim, do you want to touch on others?
Yeah, I do. And I want to add one more thing to what you said, Dr. Gonzalez, is that I think institutional leaders really have to ask themselves some hard questions and come to grips with how we think about scholars and their time and how much time they're supposed to be working. You know, the joke that I always tell, someone told it to me years ago when I was starting my career, was like, faculty life is extremely flexible. You can choose the 60 hours a week you work to be whatever ones you want. It can be whatever 60 hours a week you want. And there are folks that pre-COVID did not have those 60 hours. And we're trying to make sure that their evaluative packages at the end of the day looked like folks who had 60, 70, 80, who could work as much as they wanted. They never could work as much as they wanted. But these conditions have limited, like that 40-hour week, that 30-hour week, that, you know, folks literally cannot put in the same amount of time, and there's no getting around it. So how can we be mindful of that? How can we be thoughtful about that as we think about how we evaluate our colleagues? And then the final piece or set of questions that, you know, we were thinking of, and some of it is related to our work with Aspire, that we think that some of the power of making change in the academy more generally is rooted beyond just an institution doing really good work and thinking, okay, how can we make our little piece of the world better? How can institutions work together and change the way that we think about these things on a broader scale? So one institution could change their tenure and promotion policy. They could change how they allocate workload and reward emotional labor and all kinds of other stuff. And that's wonderful. But how much more powerful is it when institutions generally, when a group of institutions come together and decide, no, this is the way that we do things in the academy now. So how are institutions working beyond, or how can they work beyond just their own piece of the world to think about having conversations and connections with other campuses and making some of these changes together, that sometimes it feels less scary or less intimidating to make these decisions. And frankly, you might come up with more creative solutions if you work together rather than just working in our own silos.
Those were amazing, and they touched on so many different levels from the perspective of decision makers. It's also interesting to me that as we're looking at kind of the public health decisions that institutions have to make, in some spaces institutions are communicating. And I think, you know, correct me if I'm wrong, I'm thinking there's opportunities to integrate the equity lens in that conversation and in that kind of outsourcing and coordinating and collaborating. That was pretty amazing. Thank you so much. Yes, yes.
I just want to build on that because I think, Dr. Page, you've raised something really important, and it leads to a really specific question that institutional leaders, academic leaders can ask of themselves. Who is in my network? Who do I, you know, there are all sorts of different consortiums and groups. How can I foster this conversation with them and say, we're thinking about inserting a cover letter for all our tenure candidates in the next 3 years. Are you all thinking about that? How can we put our heads together? So thinking really strategically about who is in my network, how can I get this conversation started, maybe as a one-on-one, and then maybe it becomes a larger, you know, workshop session for that consortium or group or whatnot. So yeah, we're really into thinking about how these networks could be powerful ways to share, but also encourage and provide a bit of, you know, I think higher ed is a very risk-averse field. And so how do these networks provide some sort of coverage for one another?
Wow, amazing. And really, I think captures too that this is a weighty situation and all of the things that have to be considered at one time. You know, it's a lot for administrators and decision makers. And so if we could kind of switch your hats a little bit, both in your roles of, you know, in support of and in service to faculty, but also having been faculty, when you think about being in that position or, you know, within your responsibilities to people in the position of being faculty, how can faculty advocate for like the recognition of, you know, this additional work? And I mean, in a pandemic, all I hear from faculty is just all the additional labor that they're doing to support their students and to support each other. How can they better advocate for recognition of that work? And how can they interact, you touched on this a little bit, with administrators around building a better evaluation process?
Do you want me to start this time, Leslie? You know, I think that this is emotional labor, again, has been an issue that we've seen in the literature that, you know, women, scholars of color, women of color in particular, carry a heavier load than their colleagues. This is something that we know to be true when it comes to emotional labor, and that our current structures and systems do not do a very good job of recognizing that, or even giving you a place to put it, right? Like, where do I can list all my advisees, but where do I list the people that I meet with at conferences? Where do I list the, you know, random undergrad who's not in my unit or in my department who wants to talk with me about who they want to become? And I want to do that. And I'm happy to do that, but where do I write that down, right? And I think there are two levels that the change needs to happen. So there are certainly things that we can do as individual scholars. I think a lot of the work is reliant on administrators like me, like Leslie, to build this into structures and systems to better recognize that labor. But figuring out, you know, taking a step back and figuring out, like, how do I talk about this work in my dossier and in my narrative? How do I link it back to who I am as a scholar and the impact that I've made on the academy? That committees are open to hearing that. They may not ask for it, and it may not be within the traditional, you know, boxes that you might want to put it in. But if your scholarship is directly related to how you're engaging in emotional labor, how can you start to knit those stories together in a way that really highlight, you know, yes, this is the additional work that I'm doing, that this is another contribution I'm making that goes beyond the peer-reviewed journal article, you know, that I did, or the class that I taught in my great teaching evaluations. So, you know, developing ways to kind of keep track of all of that work and not just kind of letting it go by the wayside. So, you know, do you have an office hour schedule? Can you track the number of hours per week or hours in a semester that you've spent meeting with students? Has somebody sent you an email saying thank you for the time and the energy that you've invested in me and poured into me? Can you save that and use that later and include it in your teaching portfolio or as a supplemental document as you're trying to consider promotion? Just noting the ways that we do this work and starting to keep better track of it. Sometimes we count the stuff that's easy to count, not because it's the most important. So how do we make this emotional labor more tangible is one thing that we can do on our end as individuals engaging in this process that makes it a little bit easier.
Yeah, and so building on this, thank you, Dr. Griffin. Something that we spent some time talking about in the report was, you know, lots of folks over the summer and even in the spring and the summer were involved or enrolled in lots of webinars and professional development about moving classes online and finding new strategies to engage folks. We suggest documenting that as not only part of what you did to respond to COVID, but also to sort of forefront that, that you as a scholar are continuing your own learning, your own commitment to students and to advancing your program, your department, et cetera, et cetera. And so really trying to forefront where folks invested time as a reflection of their teaching philosophy, mentoring philosophy. So again, it's finding ways to track it and not just sort of, you know, kind of tracking it numerically, but as Dr. Griffin said, really incorporating it into the body of your work. And as Dr. Griffin also said, right, and I think somebody also put this in the chat box, when it comes time for evaluative committees, whether that's an annual evaluation committee or it's, you know, third year review, promotion review, that committee then has to have the tools to recognize and say, oh yeah, you know, COVID-19 happened and wow, this was really valuable that this scholar spent, you know, 3 weeks in this online webinar or online class to learn how to better engage their students. And so we have to then foster what I call sort of a learning forward approach and evaluation, meaning an evaluative process that really values the learning that faculty are doing to cope with COVID. And so these are some of the ways that we think folks can track and account for and essentially advocate to have their work recognized.
I think one follow-on question from the Q&A that we have on this very topic, right? So we're tackling this one side, which is how do you kind of quantify and qualify all of this extra work you're doing, which is really, really valuable. But on the other end are those standard metrics that already exist, like funding and publication. So as we know, like women and folks of color are being more affected and are less likely to publish as much, and their funding might get pulled in different ways. So how do we also work with these committees and with ourselves to balance both what we're doing more, but also what is being taken away from us in a lot of ways? Can you speak to that?
I think that speaks back to what Leslie mentioned earlier about what does it mean to be a productive scholar in these times, right? So we're not only dealing with a pandemic, for example. I'm thinking about conversations at my own institution. So we're dealing with, global health pandemic. We're also trying to figure out, like, how do we deal with, combat, use this moment to address issues of persistent race and racism on our campus. The same folks are being pulled into those conversations over and over again, right? So, and at the same time, I feel like folks are being more mindful. Like, I know that women are being more heavily taxed right now. I know that people of color are being pulled in a million different directions. I don't want to pull them into this conversation and have it not mean anything. And I was like, well, pull them into the conversation and have it mean something, right? Like, if this now has value, if I have somewhere where I can write down that, like, I contributed my time to this, and this matters in a way that's really significant and isn't just that third rung of service that we sometimes don't think about so much, that it is my contribution during this time and it is a form of productivity that's really valued, then you will get the people who are really passionate and engaged about it, involved in it, without it feeling like it's such a professional hit at the same time, if that makes sense.
Yeah, I really love that question, Aspen. And I think that, in our thinking, I think that you'll see that Kim and I are always trying to think about how do we, yes, provide individuals with strategies and suggestions and support systems, of course, but then also how do we then bring this problem or this challenge back to the organization itself? Like, what do we need to do in the sort of the culture and the practice of the organization in order to really support those that are being most affected? Mm-hmm. And I think a lot of our energy right now as academic, institutional leaders needs to be going to those folks that hold what we call evaluative power. Like, how are we going to tinker with and revise, our mental models, the heuristics, the schemas that we use to evaluate faculty? If we are only willing to have a conversation about what strategies do we give to folks that are affected, mm-hmm. That's not really an equity-centered approach, right? It's really about changing the fundamental sort of structure and cultural practices of universities. And that takes a lot of work, particularly with folks that hold evaluative power.
And I think that's one aspect of the report that I think is so powerful for, there's another word I really am trying to say, but it's effective, is that it essentially functions, you can pull it into different sections and use those individual sections as white papers and kind of give the language to administrators too, that help them align, maybe an endpoint, or, there's a space where you're seeing some disparity or inequity arise, but how do you really address it? And I think for some administrators, particularly who maybe haven't, just in the scope of their role, they have to be able to synthesize these issues really rapidly and synthesize them in the lens of making urgent decisions. So that was one thing that I thought was pretty amazing about the report, and some other reports and resources that we've seen with the lens of equity, is that you're essentially providing this really targeted, focused tool set to people to be able to kind of say, even if you are faculty, I think to be able to just to take that to an administrator and to say, these are some of the things that, we're discussing and that we're, are definitely on the table. Here's how to really make it effective and not let go. Like, I love the subtitle, "Don't Let Go of Equity." So yeah, that was a great question. And I do want to briefly you'll see more of Aspen, but I do want to let you all know that Aspen Russell is a research assistant for A-List and ARC Network. So you will hear more from Aspen in a few minutes, but I just wanted to take a moment to introduce her. So as we kind of get through, coalescing the, all of these different dimensions, all of these different pieces that administrators need to think about. And again, I love the conversation around collaboration, like not just focusing on your microcosm, but expanding beyond that as you're, administrators and looking at your network. We're still in this thing. And we have amazing people working to improve outcomes, to make therapeutics available, vaccines available, but we're still in this thing. So for you, when you think about, the major challenges and barriers, what are the ones that I guess kind of really rise to the top for you when it comes to ensuring awareness of the impacts of disparities on faculty advancement and just even more broadly, equity and inequity and that impact that it's having on faculty?
Either of us can start. I don't mind starting, it's fine. So I'm gonna go back to a comment that Dr. Gonzalez made earlier, that some of the things that we are suggesting challenge traditional notions of what it means to be a good scholar. And what does it mean to be productive? How do I compare this person versus this person? And that there is some aversion to putting in policy that we're going to engage in equity-based policy rather than being equal and treating everybody the same. That we are looking for ways to continue to do what we're doing and just make this small adjustment because this thing happened. So let's make this small adjustment and it's going to count for the thing, but we're going to be able to continue business as usual. But I think one of the powerful things about this moment and us having to both speed up things, but also slow down things in many cases, is it allows us to really revisit policies, revisit practices, and make fundamental changes to them. Because again, while yes, the pandemic has created some new disparities, in many ways it has just exacerbated what has already been there in existing policies and practices. So why not just fundamentally change the policy and practice to mitigate the disparity? That instead of laying something on top of it, like, see, we fixed it for COVID-19. Like, no, let's just change the policy and practice so that it's not inequitable. And I think sometimes having that shift or that change in thinking, that inward look, as opposed to let me provide you with the resources to navigate this structure and system that didn't work that great before, can be a hard shift and a hard change to engage in. The one other thing that I would share that I think has been really challenging is that, we don't know how long this is going to go on. But I think the initial thought was it was going to be relatively short term. So let's have a short term solution. So if things have slowed down for a year, then we'll give everyone a 1-year extension on tenure and promotion and everything will work itself out. But we have no idea how long it's going to go on. And I think it's very hard to say that, like, adding a year or adding something commensurate to the amount of time that things were slowed down is really going to bring things back to where they need to be. That we need to think in terms of short-term solutions, like how do we stop the bleeding? How do we help people in this moment? But how do we keep policies and practices in place that are gonna, we may be sitting down at a tenure promotion meeting in 2026, having a conversation about what happened in 2020. And that isn't gonna, that shouldn't be an abnormal thing, that we need to kind of be open-minded to the fact that we have no idea how long these policies need to be in place. We have no idea how long individuals are gonna need support and resources. And that can be an uncomfortable place to be in, but like just sitting in that discomfort of that we just don't know what we're gonna need and how long we're gonna need it.
Yeah, Dr. Griffin, he said it all. It's so good. I'll offer a few more things that we've chatted about. One of the barriers or challenges I think that we think that we'll have to deal with is, I think institutions are much more comfortable, and I mentioned this earlier, with sort of an equality framing versus an equity framing. And so just like Dr. Griffin mentioned earlier, right? In building new support systems or policies, we are suggesting that administrators take an account of the faculty in their program or department and understand, to the extent that people are, comfortable sharing, what are the different conditions or contexts of people's work, and then building support systems that really sort of start from or center those who are most, for lack of a better word, vulnerable, marginalized, et cetera, et cetera. That might mean starting with a single caregiver in your department and figuring out what hours are best for them to teach. How do we move workload around this person, especially if they're pre-tenure or on the non-tenure track? So how do we start with these folks, center them, and then build systems around them? That is a very uncomfortable, and I think I'll dare say this, sort of an uncommon approach to how we think about systems, processes, et cetera, because the question will always arise and say, well, can we do that? Can we sort of account for one person's situation more than others? That's not really fair. We are suggesting, particularly when we're thinking about historically underserved, underrepresented folks that are really struggling with this particular context, right? That starting there is the only way to ensure equity in terms of outcomes, because equity ultimately is about outcomes, right? So that is going to be a barrier. And to Dr. Griffin's point, this will have to be an ongoing conversation. This is going to have to be something that folks are willing to revisit lots of times and probably in lots of different ways. We'll also offer this point, and this is something that I think that we've not struggled, but I think we've sort of wondered how best to go about talking about this. You know, initially when lots of when COVID had initially hit, and we were seeing lots of social media postings and a lot of, for lack of a better word, like hot takes on like what this means. A lot of the discussion was framed around, well, we're working from home and we have family caregiving responsibilities and there's no way we can be as productive. And that is all true. We've already talked about that for about an hour here. However, Dr. Griffin and I have talked a lot about the fact that, COVID's impact, both in terms of rate of infection, deaths, experience, and unemployment rates have hit communities of color the hardest. And so we think that it is necessary for academic leaders, institutional leaders, to think about the immediate and downstream mental health, emotional health challenges wrought by COVID-19. And that is not necessarily an easy conversation to foster in our institutions. But as Dr. Griffin said yesterday, as we were talking about this, there's a lot of trauma that folks have experienced. And how do we create institutions, departments that are resourced and have the capacity to facilitate those kinds of conversations? We think that that's going to be an important barrier to address. And I want to give a call out to Dr. Rihanna Elise Anderson's work at University of Michigan. She's been doing a lot of work around the racialized effects of COVID. And so I just want to sort of highlight her work because I think it'll be very informative for some years to come.
And again, I think in this time where we have everything happening with the COVID-19 pandemic, all the racialized impacts associated with that, coupled with this heightened attention, it's always been happening, but heightened attention anyway, and heightened visibility of the violence that is inflicted on Black and brown bodies, that folks are experiencing secondary trauma, primary levels of trauma associated with those things. And again, like we have a language to talk about child rearing. We have a language to talk about elder care to some extent. We don't have a language to talk about that and what might be necessary in terms of support that individuals might need at this time. I don't know that everybody would feel comfortable sharing the ways that they feel with their department chair or with their dean about those things and how it's having implications on their work, or maybe even having implications on their students, which is leading more to that emotional labor that they're having to engage in, that is part of this context too. And I think, getting folks to a place where they can at least sit in the discomfort of that. They don't have to be comfortable talking about it, but sitting in the discomfort of that it's not just, while it is child rearing, and I think that's like a personal, like, yes, please help us with the child rearing and the balancing of that. But there are also all these other complex things that are happening. And some of the things require a very specific response. But I think a lot of them just require a different way of thinking about how we support faculty from an institutional perspective, and being open to that fundamental shift in thinking, as opposed to like, okay, this person has a child at home, I need to do this for them. This person is dealing with trauma associated with the loss of a parent due to COVID-19. I need to deal with them this way. It's more like, how do I deal with my faculty? How do I support them in a way that's very different than I've been called to do so before?
And I love that you've both in this conversation really expanded really broadly to the global impact. There are so many things that are happening that can detract from or contribute to the success of an individual. And right now, the moment is, I think, calling us to really consider the entirety of the person and the entirety of our communities, that we can't necessarily continue to have this compartmentalized perspective and sort of say, you know, my faculty fit in this box, the box that I can make decisions around and support, that's the box that they're in. We have to really think more expanded, in more expanded ways, especially because inequity calls us to do that. So I really appreciate just bringing that to the forefront of this discussion. We're looking at time, and it's time for me to switch over to give Aspen the mic to moderate. She's been following the Q&A and the chat to kind of see what our audience really wants to know from you. And so I will hand the floor over to Aspen, and thank you so much for the conversation to this point.
Thank you.
All right. Now I get to have some real fun. This has been a fabulous discussion. I'm glad I got to stay. I don't crash the entire thing, and then right when I have to do Q&A, it does. I love Zoom. It's a great world we're living in. Okay, I'm just gonna assume folks can hear me. All right, I'm just gonna jump right into a theme that has been throughout this entire conversation, right? Is like, how do we send
So it looks like Aspen is coming on. Okay, Aspen, can you start from the beginning? You froze just as you were starting to ask your question.
Okay, can you hear me now?
Yes.
I am in #rural America, so this is new for me. So small ends, I'll just get right to it. How do we deal with them? And some of these suggested solutions are things like faculty equity dashboards. So not only how do we care about the way we collect data, but also represent it in service of making systemic change.
So how do we manage small ends, like small numbers of people? And then how do we make sure those dashboards are really an accurate reflection of what folks are doing?
Absolutely, and privacy and surveillance and those types of things as well.
Understood. I have a thought about the dashboards and how we talk about service and how we talk about emotional labor. So I often think in terms of a matrix when I think about service. And on one end, there's visibility, and on the other end, there's prestige. So there's like very high, or I'm sorry, visibility and time. You need to invest in it. So there's the high visibility, high prestige things. There's the low visibility, low prestige things. And you can have something that's high prestige, high visibility with a high level of work, or with a low level of work. And then you can have things that are low visibility, low prestige with not much work versus like really significant time investments. And I think to the extent that dashboards help us see not only what are people doing, but place them in those different types of buckets, particularly the high workload stuff, that can be really, really helpful. And that review committees are mindful of those things, not just kind of the ticking things off in their brain, like, oh yeah, we want people to do things that are like university senate and, you know, working for their professional committee, and sure, they have enough students, like really thinking about how much time and energy folks are investing in different activities, particularly the ones that aren't as visible or aren't as prestigious, I think is really, really important as they move in that different direction. I think the low ends piece is really, really challenging and really difficult. As we talk to individuals and as we try to understand their unique context, I don't think it's necessarily to talk to them to take their story and to co-opt it and share it. I think it's more to understand, like, okay, what are some of the unique barriers that you're dealing with? And that while someone might have something that's very unique and very specific to their individual identities, that there might be an undercurrent or a similar theme, if we're thinking like qualitative researchers, that would link them to somebody else that maybe isn't quite as small an N, or that would help us cluster things together. And so rather than displaying and showing like, well, there's this individual person, we're not going to put their name on it, but you can kind of guess who they are and here's what they're dealing with. Here's a collection of issues that these folks experience that are similar and that we can develop similar strategies to address might be a more thoughtful way to go about it. I'm not sure if I'm fully answering the question. Leslie, do you want to add anything?
I think what I'll add, I don't know if it'll directly respond to this question, but I think it's an important point that can be tied to dashboards and their use. So when we think about, the faculty and the development of dashboards, I think that for the most part, dashboards tend to track, those that are on the tenure stream, maybe those clinical faculty or, full-time faculty. And of course, every institution has these different categories. But I want to also just make the call or highlight that in those dashboards, we should also be including, if we're really thinking about impacts of COVID on folks that have academic, instructional, research responsibilities on campuses, we should be thinking about including our postdocs in there. We should be thinking about including any person that has sort of this instructional research responsibility on campus, because their work matters too. And in a lot of these roles, whether it's postdoc or whether it's, a teaching faculty person or a clinical faculty person, again, these are going to be more likely to be folks that are of color, women in those positions. So I just want to kind of, as we think about dashboards and small n's and complicating the data, I think that's an important dimension to also bring to the conversation.
Absolutely. I think these are really fabulous responses as we try to be more critical, because it sounds like just from our chat, a lot of places would be setting these up for the first time, which is a great opportunity to use best practices, right? It's much more difficult for a lot of places to steer the boat than it is to start that journey. So I want to add a follow-up that we have from the Q&A about dashboards. First, just for our audience, if we could have a quick overview of what a dashboard would look like and why we would use it. And then second, especially from a leadership position, who is going to take on this labor and how will that affect the service time that it takes to implement that, who we are asking to do that. So questions about that labor is what we're getting as well.
I have not had the opportunity to work that much with dashboards, but have you, Leslie, have you gotten to work with them a little bit?
I haven't personally. We're actually in the very beginning stages at Michigan State of developing a dashboard, and so I'll give sort of a broad kind of a definition, if you will, of dashboards, because I see a few questions around that in the chat. So dashboards are sort of it's a platform where faculty or staff, whoever might be included in the categories that are being asked to include their information, they essentially just report how much time they're giving to different kinds of activities relevant to a faculty role, or how many advisees they have, et cetera, et cetera. So it's very much kind of a time tracking kind of a tool. And the idea behind it, and I think that for the most part, the work that I've seen published comes out of Karen O'Meara's work, Joya Misra's work, Audrey Yeager's work. There's a team of folks that have been working around dashboards for a while now. The idea is if we can get faculty to document how they're spending their time, what their workload really is in practice, then we can identify those inequities that are manifest. For example, it's very common for women faculty to have higher mentoring or advisee loads. And so how do we capture that, and then how do we account for it later on in the evaluative process? So that's the gist behind the dashboards. I haven't had a lot of practice facilitating them, but I think in terms of that additional workload. I'll share this. At Michigan State, my role, which is called the Faculty Excellence Advocate, it grew out of a National Science Foundation grant back in 2008. And the idea of the faculty advocate on campus, every college has one, and our roles are to provide faculty-centric advocacy. I could see a person like me or like this sort of having that responsibility, but I think also, I don't know, Kim, if this is something sort of in your scope of work that you might look after at some point. So I'll pass the mic.
No. So I'm thinking of workload at a couple different levels. Ideally, so I don't know how many of you folks have on your campuses, you know, these online systems that are supposed to record what we do every year and kind of almost be a digital CV. I think ideally it would import that information from that platform into a dashboard ultimately, right? That it wouldn't take a lot of labor, I hope, on behalf of the individual who's engaging in the labor. But if you did, it would be just to, you know, again, put things in those different categories and to kind of document what you're doing in a way that's consistent with what we do for yearly reviews and things anyway. I think someone in my role and in an associate dean's role certainly could be someone who's supervising that, but I think that they can be particularly helpful in terms of department chairs looking at this information when they're allocating workload and trying to figure out how they're going to, you know, the next time they have a committee that they need to invite someone to participate in, who are they going to ask? Let me check the dashboard and see where folks might be in terms of their engagement in service right now, and maybe that will inform your ask. Or as somebody is preparing to go up for promotion, you can see on the dashboard what they've already done and where there might be gaps in their service. Or maybe they're doing so much service that it's not leaving them enough time to engage in some of the other aspects of their work, and that, you know, you can make some adjustments based on what's in the dashboard. That it allows kind of clear, consistent information that allows you to compare across folks. Evan's saying hi to everybody.
Great. I'm going to jump in now. I just wanted to highlight that in the chat, for folks who didn't see yet, thank you, Don Culpepper, for adding a recent publication on the topic of faculty dashboards. So for folks who want to get a little bit more information, see how it's happening in practice, please check that one out. And we also wanted to provide, as we do with the curation of resources, a couple of additional readings for you all to consider. Of course, if you have not yet checked out the report we've been discussing today, we are including links to it in the chat now. Please share it widely. We also wanted to highlight that the St. Mary's College of Maryland has started a website, which is a living document of conversation of resources for women in STEM specifically, and addressing COVID-19. Just a moment. Also wanted to highlight for you Doctors Goodwin and Michnick's op-ed on STEM equity and inclusion uninterrupted, which is inside higher ed. And this is highlighting how the pandemic will negatively impact the careers of women in STEM, particularly women of color. It's worth checking out Intersectionality Matters, a podcast hosted by Kimberly Crenshaw, which many of us are probably familiar with as the originator of the term intersectionality, and also hosted by the African American Policy Forum. And finally, you might want to check out Doctors Ethel Mickey, Desi Clark, and Joya Misra's op-ed that just came out recently, also in Inside Higher Ed, colleges to support faculty during COVID-19, where they provide concrete examples of how their institution is supporting faculty during the pandemic. We also want to remind you that all ARC Network members have access to a collection of nearly 2,000 resources related to equity in the academy that are housed in our resource library, which is accessible on Mendeley. You can join the ARC Network and the Mendeley platform by visiting, as I mentioned earlier today, equityinstem.org. We also want to encourage you to join us at our next webinar, which is going to be hosted in 2 weeks on September 24th at 3 p.m. Eastern, to meet our third cohort of virtual visiting scholars and hear about really innovative projects that are focused on intersectional equity in STEM. We do really value feedback. We look at all the responses. We think about how we can improve webinars. So I would encourage you to take the 5 minutes max to complete our feedback form. The link is in the chat box. If you have any additional resources that you think of based on this conversation, you can put them there, and we can also make sure to share them out with folks in our follow-up correspondence to this webinar. Once again, I want to thank you both for your time. You couldn't see it, but my neck hurts from like the vigorous head nodding that was going on throughout the presentation. Really appreciate your commitment to the work, to ARC Network today. Thank you to everyone who attended, your insights, the great conversations, and we look forward to continuing the work together to ensure equity in STEM and beyond. Have a great day, everyone. Thank you for your time.
Thank you, everybody.